Welcome back to TV5 News at 9. Great Lakes Bay Health Centers is showing us a roadmap to better health. And joining us this morning is our great friend, Senior Vice President, Nurse Angela Williams. Angela, thank you so much for being here with us.
It's a pleasure to be here again. Thanks for the invite.
Yes. So today we are talking about respiratory preventative care and how it's the key to better health outcomes. So right now we're in the season of cold and flus, and COVID is still out there too. So what are some important tips and information that people should know?
Well, first of all, we're in that season where you get a sniffle, you get a sneeze, you get a cough, runny nose, itchy eyes. You don't know if it's an allergy. You don't know if it's COVID, a cold, flu, pneumonia, whatever. And so we have to all take precautions regardless. And so what we're trying to educate everyone is don't ignore it. Get tested. So of course, here we go again with another about COVID. So it's important to get those COVID tests. Test yourself. Rule out COVID before anything else. And right now at Great Lakes Bay Health Centers, we are limited in our ability to provide free testing. However, home testing kits have been released by the government. So if you see that opportunity to register for those kits, please get them because they cost more than $20 in the store. So that's number one. Number two, paying attention to your body. Calling your physician if you feel like you need to be tested or examined. Don't ignore the symptoms. And again, right now, the number 3 viruses, respiratory viruses to really pay attention to are COVID, flu, and RSV. And RSV, respiratory syncytial virus, was out. It's been out for years, but as you recall, last year there was a high prevalence of RSV in older adults, meaning age 60 and older, where people were literally dying in the hospitals because of this virus. And so again, you don't know the difference, so you have to pay attention to the symptoms. So we are here to just educate, and still, as I've come on here many times before, we all have to take care of our health. We have to become educated and know what to do in terms of taking that annual physical and expressing your concerns to your doctor.
Hey, Angela, tell us, what are some of the vaccine options that are available and for what reasons?
Well, some of the vaccine options right now are, first of all, flu shot has been around for years and years. This is the month that we encourage everyone to get your flu shot. Try to get it before the end of October. Flu season runs usually from early September through January. So make it a goal to protect yourself by getting your shot by the end of October. Flu shots are readily available everywhere. Every drugstore, when you go to pick up your prescriptions, they're actually offering the flu shot. What people are not aware of is the RSV vaccine, which is available now for 60 and older. And so they offer a combination of you getting your flu shot and your RSV. And this reduces your risk of being hospitalized with complications that could lead to death, unfortunately. So this is a serious respiratory problem that the hospitalization can be alleviated if you take the shot. So personally, 3 weeks ago, I took my flu shot and RSV at the same time. I'm one of those people over age 60, so I'll put it out there, and I had no side effects whatsoever. But I want to stay protected so I can be a messenger to other people, for one thing. And then in addition to COVID-19, we have a new variant out. Great Lakes Bay Health Center, we do not have the vaccine available. However, local drugstores do have it readily available. So if you are interested in receiving a vaccine, we want to encourage you to please protect your health. So you can call any drugstore and make an appointment. And again, I just had my COVID vaccine on Friday, and I had no side effects, so I can happily say that.
You can vouch for it.
Yes, I can.
All right. So, Angela, tell us, we have discussed, paying attention to symptoms when you get them, getting your vaccine. What are some other ways that people can protect themselves and others?
Well, first of all, if you think that you have the sniffles, call your doctor. Pay attention to your health. If you feel like you're getting worse, call your doctor. Let them know what's going on. At the same time, try to isolate yourself from the rest of your family members. In some households, that is difficult, so you want to just disinfect as much as possible. In addition to that, I say the #1 defense against any illness is washing your hands, and that's research-based. So keeping your hands washed, avoiding touching your eyes, your nose when you're sick, sanitizing, wiping down surfaces, but at the same time, making sure that you take care of your physical health by drinking plenty of fluids, getting plenty of sleep, eating as healthy as possible, and getting that rest.
Yeah, so what are some of the benefits of preventative health care?
Well, your mental health, your physical health, and your emotional health becomes exacerbated to a degree if you become ill. Depression,
Yeah.
you know, if you find out that even one of your family members is suffering from COVID, we know the losses that people are experiencing, and it doesn't even have to be a loss in your immediate family. It could be a loss of a friend, a pet, but supporting your well-being and your mental health. And we are available at Great Lakes Bay to support not only your physical health, but your mental health.
And you know, you bring up a good point, Angela, because being sick just isn't fun, honestly.
No, it's not.
It just makes you kind of sad and mope around.
Woe is me.
Woe is me. So that makes so much sense. So Angela, anything else that you want to add?
Yes, I do. I want everyone to know that Great Lakes Bay Health Center is accepting new patients. We accept anyone for services regardless of your ability to pay for services, meaning that we can help you if you're uninsured to register for Medicaid, Medicare. We also take commercial insurances, so a lot of people are not aware that it does not matter what your insurance status is. You are welcome to receive services at our facilities. It's a great time to make sure not just you, but your family is protected against serious and deadly illnesses. But again, I always emphasize know your health status regardless.
Yep. Well, Angela, we always thank you for coming in and giving us your expertise.
Well, thank you.
Yes, we appreciate you. All right, so if you at home would like any more information on this topic and staying safe and healthy, head over to the hot link section of our website, WNEM.com.